Want to talk to you about 5 items not covered by Medicare. Why is this such an important topic? Because chances are, if you're starting Medicare, you're turning 65, you're in or near retirement, and you need to have an understanding of what your retirement's going to cost you, what's covered, what's not. So let's take a look. Now, before we get into what is not covered, let's talk about how you figure out what is covered. You see the title of this book right behind me, Medicare and You 2023. Every year, the Centers for Medicare and Medicaid Services puts out an updated version, and it's an excellent resource. You're going to find on pages 25 through 56 a section titled, Find Out If Medicare Covers Your Test, Item, or Services. So definitely take a look at that book. You can download it on the internet. If you are more into technology, you also can download this app. It's Medicare's What's Covered application. Find it right in the app library, and then you can go in and type in an item. For example, right there in the middle, you see it says, is my item or service covered? So let's say you type in mammogram. It's going to pull up information from the Medicare.gov website as to how often or whether or not a mammogram is covered. So now let's go to those 5 items I want to talk about that are not covered by Medicare. On page 56 of the guide, you can see there's multiple items listed that are not covered. I'm narrowing it down to 5 specifically, but you can go to that page if you want to see what else is listed. So let's start by, first of all, I had a client go up to me the other day. She says to me, what about my eyes, my ears, and my teeth? She's asking me, does Medicare cover these things? Because obviously, everybody as they age have to think about keeping their eyes healthy, their teeth healthy, and they want to be able to hear. So what does Medicare do under those circumstances? Now, you've probably seen a million commercials. You saw Joe Namath, you saw J.J. Walker talking about coverage for your teeth, your ears, your eyes, okay? And then you also hear something, well, Medicare doesn't cover those things. So those commercials are specifically about Medicare Advantage plans where they may cover some additional items that original Medicare doesn't cover. What I'm talking about today is original Medicare. And I will tell you, there are a lot of Medicare Advantage plans, which is an alternative to original Medicare, where some of this stuff is covered. But you never want to choose your health coverage based on perks that Medicare Advantage may offer. You want to first find plans that cover that your doctors accept, that your drugs are cost effective, and then you can celebrate the perks. But my whole discussion today, again, is on original Medicare. So let's start talking about your teeth, dental coverage. Fillings, tooth extractions, dentures, dental plates, other dental services are not going to be covered by original Medicare. Now, if you think about it, pre-65, the plans that you're on, it doesn't cover dental and all that stuff. You typically have a separate plan or you are self-insuring. So what are your options if you're on Medicare and none of these things are covered, your cleanings, etc.? You can get private insurance. You can purchase a plan for a monthly premium. The plan is going to define exactly what's covered. Typically, there's waiting periods. Can't grab a plan to then get a crown covered. They often make you wait a year before they're going to cover that. Or you can continue to self-insure. But so that's how it's going to typically work with dental coverage, unless you go into that Medicare Advantage plan where you may find really good dental coverage. The next thing let's talk about are your eyes. So routine eye exams like refractions to get eyewear or contact lenses are not going to be covered by Medicare. And yes, you may get that covered by Medicare Advantage. You could go out and get that private plan that I talked about also. But just understand that while these routine exams are not covered, there are some health-related exams that are going to be covered when you're in Medicare when it relates to your eyes. First of all, cataracts. Medicare is going to cover cataracts. The way that it works under original Medicare is it's going to be covered at 80%, and then you or your supplement's going to pay the remaining 20%. There's also glaucoma tests. You can get one every 12 months if you're at high risk for glaucoma. There is diabetic retinopathy. You can get one of those exams once a year if you have diabetes. And then if you have macular degeneration and it's based on age-related macular degeneration, then the tests and the injections, the treatments for it are going to be covered by Medicare. Now let's talk about your ears. So routine hearing tests are not covered. So in other words, if there's no problem with your hearing, but you're just going in, you want to get it checked, that is not going to be covered by original Medicare. In addition, if you do need hearing aids, that hearing aid exam or the fitting for the hearing aid is not going to be covered by Medicare. But what does Medicare Part B cover? Let's say that you are having a hearing problem or a ringing in your ears or something with your balance, and your doctor believes that it's medically necessary to figure out why you're having these problems, and they submit an order for that, then you will be able to get that test. Now, again, you see those Medicare Advantage commercials, and yes, hearing tests could be covered even if it's just routine, and they may even pay for hearing aids, which are not covered by Medicare. So if you're in original Medicare, what are your options? You can get private insurance, or you can self-insure and pay for it yourself. So that covers your eyes, your ears, and your teeth, your mouth. So let's talk about another item that is not covered by Medicare. That's going to be a routine physical. So you're like, wait, what? A routine physical is not covered. Probably all these years leading up to Medicare, you were getting a routine physical where you go in, doctor runs blood works, just checks in with you. But if you call your doctor's office while on Medicare and you say, I want a routine physical, you're going to end up paying for 100% of that if you're just going in for some sort of treatment or diagnosis. So what is covered? When you're new to Medicare, new to Part B, in those first 12 months, you can get what's called an initial preventative physical exam. So what happens during that? They're going to review your medical and social health history. They're going to go over preventative services that are covered. And then they're going to know for the future, like what kind of tests, et cetera, you may need. Now, if you go to a doctor who accepts assignment with Medicare, there's no cost to you for that exam. So now you're in year 2 of Medicare. You've already had your initial preventative physical exam. And now what you can get under Medicare, no cost if you go to a doctor who accepts assignment, is an annual wellness visit. So in that visit, what happens is you're going to develop or update a prevention plan and perform a health risk assessment. So based on that, maybe there are some tests that you're going to need. But again, it is called an annual wellness visit, not a routine physical. Now, the last thing I want to talk to you about, and this is the biggest one, the biggest gap of all, that everybody needs to think about when they are planning for retirement. Medicare does not cover long-term care. Medicare does cover some skilled care, but long-term care is custodial care. So when you think of someone that's aging and they have some sort of cognitive issue, or they need help with 2 out of 6 activities of daily living, like bathing, dressing, eating, toileting, continence, transferring, that is going to be custodial care, not covered by Medicare. The graphic above me, that's something put out by the Centers for Medicare and Medicaid Services, where they give a description of custodial care versus skilled care. So as I mentioned, skilled care is going to be covered under Medicare. And what it is that is going to be like physical therapy or occupational therapy. Let's say you go and you have a hip replacement, you have a 3-day hospital stay, and now you need some skilled care at a facility. For days 1 through 20, Medicare is going to cover it all. There's no coinsurance. If you qualify to stay beyond those first 20 days, days 21 through 100, Medicare is going to pay all but $200, up to $200. That's a coinsurance. And either you're going to pay that or you have a supplement that's going to cover that. But again, remember, there are things you can do when it comes to long-term care in the marketplace. You can get traditional long-term care or a hybrid policy that can help cover part of the costs that are not going to be covered by Medicare. So the guy behind me, that's my brother. We are a brother-sister team. We also work with our dad. We have been in business since 1968, and Medicare is our day in, day out, the way we help people. So you're always welcome to reach out to us at the number up above or go to our website, send us an email, but we are here to help. We love what we do, and we love connecting with you to help you solve and plan well for your retirement when it comes to your healthcare costs.